A video lecture for the infection and inflammation content. So first of all, immunity is the body's natural or induced response to infection and its associated conditions. So really, the body has a defense mechanism to try to decrease infection. The human body is constantly threatened by foreign substances, infectious agents, and abnormal cells that can essentially cause an infection. So functions of the immune system would be to protect the body from foreign antigens, identify and destroy potentially harmful cells, remove cellular debris such as damaged or dead cells, and defend the body from infection. So let's talk about leukocytes. Leukocytes are also called white blood cells. They're the same thing. They are the primary cells in both non-specific and specific immune responses. They attack and destroy anything that the body considers foreign. And the normal number of white blood cell count within human serum is 4,500 to 10,000 cells per millimeter cubed. Leukocytosis is a term that refers to an elevation in the number of white blood cells in the blood, and that would be if there are greater than 10,000 per millimeter cubed, and leukocytosis often occurs in the presence of infection. Leukopenia is a term for a decrease in the number of circulating leukocytes, and it would be if there are less than 4,500 cells per millimeter cubed. So there are three different types of leukocytes, main categories at least: granulocytes, monocytes, and lymphocytes. Granulocytes have a key role during the acute inflammatory and infectious response. And the types of granulocytes are neutrophils, eosinophils, and basophils. And then monocytes activate immune response against chronic infection. And those consist of macrophages and dendritic cells. Lymphocytes are the principal effector and regulator cells of specific immune response to protect the body from microorganisms, foreign tissue, and cell mutations or alterations, so they protect the body. And those consist of T cells, B cells, and natural killer cells. And then there are antigens, and those are agents that provoke a specific immune response when introduced into the body. And then antibodies are basically the primary agents of cell-mediated immune response that attack the antigens directly by activating B cells. So if antigens somehow enter the body, whether it's through a cut or scrape or whatever, then antibodies are sent to attack these antigens directly. So the lymph system, or the lymphoid system, plays an important role in immunity as well. And the lymph system consists of lymph nodes, the spleen, the thymus gland, bone marrow, lymphoid tissues, and tonsils and adenoids. And there's information in your book about these different structures of the lymph system. But basically, the lymph system exists to recover proteins for the vascular system and to protect the bloodstream from invading organisms. So infection is the invasion of body tissue by microorganisms, and then that can cause the potential for illness or disease. There are 4 categories of microorganisms: bacteria, viruses, fungi, and parasites. Bacteria are definitely the most common infection-causing microorganisms. Several hundred species of bacteria can cause disease in humans and can live and be transported through air, water, food, soil, body tissues and fluids, as well as inanimate objects like counters and doorknobs. Viruses consist primarily of nucleic acid and therefore must enter living cells to reproduce. Common viruses include rhinovirus, which causes the common cold, hepatitis, HIV, those are types of viruses. Fungi include yeast and molds. Candida albicans is a yeast that's considered normal flora in the human vagina. So some bacteria live within our body or even on our skin, and it's considered normal flora, like bacteria that you would normally find there. Sometimes this bacteria has a function and role to try to keep our bodies functioning properly. And then parasites are organisms that live on other organisms. They include protozoa, such as the protozoa that cause malaria, and can also include helminths, those are worms. And then there are arthropods, which are mites, fleas, and ticks. So those are all examples of parasites. And all of these different microorganisms can certainly cause infection. So then there's something known as an asymptomatic or subclinical infection, and that's where the microorganisms are present, but they don't produce any clinical evidence of the disease, or the client will not have any symptoms of that infection. So then disease occurs when the microorganisms produce a detectable alteration in normal tissue function. So that's when there are symptoms present. Communicable disease is an illness that is directly transmitted from one individual or animal to another by contact with body fluids, or it's indirectly transmitted by contact with contaminated objects, airborne particles, or vectors such as ticks, mosquitoes, and other insects. Infectious disease is any communicable disease that is caused by microorganisms that are commonly transmitted from one individual or animal to another, or from one animal to an individual. And this information is all in your book. So then let's talk about how infection really occurs. So colonization would be the process by which strains of microorganisms become resistant flora. In that state, the microorganisms can grow and multiply, but they don't cause disease. Infection occurs when newly introduced or resistant microorganisms succeed in invading a part of the body where the host's defense mechanisms are ineffective and the pathogen causes tissue damage. So that's when the infection occurs. So the types of infection, there's local infection, and that's where the infection is limited to a specific part of the body where the microorganism remains. So example, I could have an infection of my toe. That would be a local infection. Then there's a systemic infection, and that's when the microorganisms spread and damage different parts of the body. So if my toe infection worsens, it could get into my bone, it could get into my bloodstream. That would be a systemic infection. An acute infection is generally, it appears suddenly and it lasts for a short period of time. And then a chronic infection develops slowly over a long period, and it often persists for months and even years. This is the chain of infection. So I would definitely look at this information in your book. So essentially, infection starts with the etiologic agent right down here. That's whatever microorganism is causing the infection. And then the next stage is it goes to the reservoir. And there can be many types of reservoirs, which is essentially the source of where the microorganisms are. So there can be humans can be considered a reservoir, plants, animals, or just the general environment, like maybe a pond full of water could be a reservoir. Then there's the portal of exit. That would be the next part of this. and that would be how the microorganism leaves the reservoir, so how it exits that source. And then next is the mode of transmission right here, and that would be how it's transmitted from the reservoir to the host. So we'll talk about that on the next page, on the next slide actually. And then next is the portal of entry. So that's how the microorganism enters the susceptible host. So that could be maybe they inhale it into their lungs. Maybe it gets, the microorganism gets into a cut through their skin. Maybe they touched a doorknob and then they scratched their nose and it entered in through their nose and they just gave them an infection. And then the next is the susceptible host, and that is any being or human that is susceptible to getting the infection that they were just exposed to. So different methods of transmission. So there's direct transmission, and that involves the immediate and direct transfer of microorganisms from one individual to another through touching, biting, kissing, etc. Then there's indirect transmission, and that would include, not like transmission where there was something in between. So it's not direct contact with that source. So it would either be vehicle-borne or vector-borne. So vehicle-borne would be if the microorganism got onto a surface, such as a counter or a doorknob, or into some food, or I touched blood, like a little bit of blood that was on the floor. That would be vehicle-borne. And then vector-borne would be if it's transmitted through an animal or an insect. And then there's airborne transmission, and that involves droplets or dust that remains in the air for periods of time and then is inhaled by the susceptible host. All right, so lifespan considerations. So newborns and older adults are at an increased risk for getting an infection. The newborns have an immune system that is immature. They are protected by immunoglobulins received from their mother, and they begin to synthesize their immune system at the ages of 1 to 3 months. So again, just very susceptible to infection due to their immature immune systems. Older adults are also at an increased risk because they have reduced defenses and lots of physiological changes that just increase their risk of developing an infection in multiple different body systems. And then the aging process alone makes their immune system not as effective, like their thymus gland atrophies, their antibody responses decline, they have reduced resistance to antigens, and then they can also have an absence of the classic signs of infection if they are to get an infection, and their normal inflammatory response is delayed. So the stages of the infectious process. The incubation period is the first stage. That's where the pathogen begins active replication but does not yet cause symptoms. So this is right before they have symptoms, and just know that people are still able to transmit this disease process in many, this infection in many cases before they even have symptoms. And then the next stage is the prodromal stage. That's where symptoms begin to appear, but they're often nonspecific and vague at first. Then the illness phase is when the pathogen proliferates and disseminates rapidly. Clinical manifestations are more pronounced and specific to the infecting organism and site. And then the convalescent stage is where the infection starts to become contained and the pathogens are eliminated. And then there's the carrier state. That develops when host defenses eliminate the infectious disease, but the organism continues to multiply on mucosal sites. So that person would still be a carrier of the disease and able to transmit the infection to others. So complications of infection would really depend upon the organism that's causing the infection and the body system affected. So obviously my complications are going to look a lot different if I have that toe infection that I discussed earlier versus I have pneumonia, which is an infection of my lungs, right? A potential infection of any, or a potential complication of any infection is sepsis. That is a severe reaction to infection where essentially the infection becomes systemic and widespread throughout the body, and it even is in the bloodstream. And then septic shock is where the body's response to the sepsis or that systemic infection results in a low blood pressure, and the body's defense mechanism for that is to protect the vital organs such as the brain, the heart, and the lungs. So what it does as the blood pressure drops dramatically is it shunts blood to those vital organs and away from the periphery, so away from the arms and legs. And that can lead to diffuse cell and tissue injury and potentially even organ failure. Some medical therapies that can predispose an individual to infection include radiation treatments, some medications such as chemotherapy, and then there are also diseases that lower the body's defense. And I know we've talked about diabetes in previous lectures, but that greatly increases someone's risk for infection. So a healthcare associated infection would be an infection that developed as a result of the client being in a healthcare facility, and it can either occur, the symptoms can occur and develop while they're still in the healthcare facility, or they may manifest after their discharge. The most common HAI is a urinary tract infection, and the reason is due to improper sterile technique while the nurse or other healthcare provider is inserting that, and also improper care of the catheter and perineal area after the catheter has been inserted. So to prevent healthcare associated infections, so I feel like obviously related to the catheters, use proper sterile technique and, provide proper care to these clients who have a catheter in place. Effective hand washing and hand hygiene is very important for not only healthcare providers, but also clients. In some cases, alcohol-based hand sanitizer can be used, but in many cases, washing with soap and water is important. Invasive equipment and invasive procedures should be minimalized because any invasive procedure increases the risk for infection. And then we talked about meticulous medical and surgical asepsis, and then also critical thinking. Just think about what's going on and what you can do to reduce your patient's risk for injury and infection. And then follow the agency policies and procedures to also try to decrease infection. So there are antibiotic-resistant bacteria, and those are bacteria that really are no longer effectively eliminated when treated with an antibiotic, or in many of those cases they have to use like a very, very strong antibiotic, which is often potentially harmful to the client because of some of the major side effects. But the main reason these antibiotic-resistant bacteria develop is due to prolonged and or inappropriate antibiotic therapy. So here's what the situation looks like. clients will often present with something that is a viral infection. Viral infections cannot be effectively treated with an antibiotic. Essentially, they need to just run their course and resolve on their own. So the most common type of viral infection, let's say a common cold. Let's say I have a cold and I go to my doctor and I just want to feel better. So I beg them to give me an antibiotic because I don't know any better. I don't realize that's not really going to treat my infection. Well, let's say they prescribe it because they feel pressured by me. And if I am taking these antibiotics unnecessarily, especially if I'm doing that a lot, then that's going to cause these resistant strains of microorganisms and to develop in my body. And that means when I really do get a bacterial infection in the future, it's going to be harder to treat. So that's how that happens. I've got several strains listed that are kind of the more common antibiotic resistant microorganisms. All right, infection. So we talked about the clinical manifestations can vary depending upon the site, and then I've got some of the common clinical manifestations listed there. So pain, fever, chills, and really it just depends on the site. So obviously if I've got my toe infection, my toe's probably going to hurt. It's probably going to be red and swollen, and maybe it'll even be draining pus. Whereas if I have pneumonia, I'm probably going to be short of breath, coughing, maybe coughing up sputum. I'm going to have fever. I'm probably going to be really tired. So it depends on where the infection is, right? So think about how will you prevent the spread of infection. See table 9-3 in your book. Hand washing is really one of the best ways to prevent the spread of infection in a healthcare facility. You really need to be washing your hands before and after each patient encounter. And then cleaning surfaces, wearing appropriate personal protective equipment is important as well. All right, so education to your client. So talk to them about some of those modifiable risk factors like hand hygiene and other hygiene. The importance of adequate nutrition and adequate fluid intake, as well as adequate sleep. And then decreasing stress levels is important as well. Immunizations will help to decrease someone's risk of certain types of infections. So those are important to provide education about. All right, so some diagnostics. So we've talked about white blood cell count in the past. Here's the normal values. I would know those. So an elevated white blood cell count is concerning for infection, as well as elevated procalcitonin. And then we're going to culture whatever area is infected. So whether it's wound, blood, other infected body fluids. And then we're going to wait and see if that grows a particular microorganism to treat the infection. So what it would look like is if someone has an infection, the provider would put the client on an antibiotic if it's a bacterial infection, because antibiotics only treat bacterial infections. And then they would probably get a culture of whatever. So let's say it's a wound infection. Wound cultures, or any cultures, typically take 48 to 72 hours to return. And so when that returns, they're going to see what microorganism grows, and then they will know which antibiotics will effectively treat that microorganism. So some antibiotics treat certain microorganisms and other antibiotics treat different. There are broad spectrum antibiotics, and until that, true source of the infection is known, the patient's probably going to be put on more of a broad spectrum antibiotic. Serologic testing can be done, as well as direct antigen detection methods to see if someone's, at risk for infection. And then if someone is on an antibiotic peak and trough level can be drawn. It's a lab that can be drawn to see if that antibiotic level is therapeutic within the patient's bloodstream. If not, then the antibiotic dosage would need to be increased, or you'd maybe want to talk to your patient about, are you taking this antibiotic? You can get some x-rays of maybe the chest, abdomen, urinary system. It depends on where is their infection. A lumbar puncture is the same thing as a spinal tap, and that would see if there's an infection in the cerebrospinal fluid, which lines the brain and spinal cord. So just know that that's an invasive procedure that really would fairly significantly increase someone's risk for infection in that area. Ultrasounds can look at different organs in different parts of the body to assess for infection. A urinalysis can check for a urinary tract infection. And then a stool culture can see if there are microorganisms in the stool that are not supposed to be there. So how do we treat infection? So identifying the organ system involved. So we talked about my toe versus my lungs, right? And then identifying the causative agent. That's really where those cultures come in play that I just talked about. And then achieve a cure by the least toxic, least expensive, and most effective. And that is sometimes a challenge depending upon your patient. But, you know, if it's a bacterial infection, they're going to get an antibiotic. We'll talk about the other medications here in a minute. But then once the causative agent is identified, therapy can specifically be tailored to, you know, that microorganism causing that infection, and then also that body system. So antibiotics, I said those prevent or treat bacterial infection. Here's some common antibiotics right here. Antifungal permeates fungal plasma membranes and inhibits synthesis of the fungal infection. So this would be used to treat like yeast type infections. An antipyretic, analgesic, and anti-inflammatory meds, those reduce fever, relieve pain, and reduce inflammation. Antihelminthic, those kill parasites locally in the intestines and systemically in the tissues and organs they have invaded. So those are for parasitic infections. So no, there's nothing here for viral, because there are some antiviral meds that can be used, but typically viruses are just the symptoms are treated, and you let it run its course, unless it's a virus that's causing some major problems. So an example is viral meningitis. That's a viral infection of the brain and spinal cord. So that's a major viral infection. So there would be probably antivirals medications given there. So just know that most common viruses are not going to really be treated with a medication. What are important nursing considerations for these drug classes? What client education is necessary? So it's really important that they take these medications at the same time each day, that they try not to miss any doses, and that they take them until they're completely gone. So don't stop it early, because then the infection will likely return. So inflammation is an adaptive response to injury or illness that brings plasma, dissolved substances, blood cells, and interstitial tissues into the area where the damage has occurred. And debridement of damaged cells, bacteria, and exudate occurs as well. The 5 classic signs, I would know these 5 classic signs of inflammation right here: pain, swelling, redness, heat, so the area is going to feel kind of hot, and impaired function. So those are the 5 classic signs. And then itis right here refers to an inflammatory response. It's usually tacked on to the end of another word, so it can help you figure out what does that mean that's going on with my patient. So if I have appendicitis, that means I have inflammation of my appendix. It's typically caused by infection. infection and inflammation go hand in hand. Just because someone has inflammation doesn't mean that they have an infection. But if someone has an infection, almost always they've got inflammation because that inflammatory response is happening. Okay, so what can cause inflammation? Physical agents, chemical agents, microorganisms. We talked about it really already. The function of inflammation is to contain injury and to destroy microorganisms. The inflammatory process is a complex response of vascular tissues triggered by harmful stimuli, can be acute or chronic. An example of a chronic inflammatory response would be patients that have rheumatoid arthritis. That is a chronic inflammatory condition that is just going to progressively get worse, and it's never going to improve or go away, and it's a chronic inflammation. Stages of inflammation are vascular and cellular responses, exudate production, so that's where the like the drainage, like if there's a wound drainage could happen, and then the reparative phase where it would restore itself back to normal functioning. So what are you going to assess? You're going to talk to your patient and get a history, try and determine their risk factors, listen to what they're telling you to see what suggests that they might have an inflammatory response. Do they have some of those 5 classic signs present? So you're going to note that when you talk to them, and also when you do your physical exam. And then also think about widespread inflammation. They can have more vague and diverse symptoms. So they might have more like, oh, I'm tired, I have fatigue, I'm achy all over. Those are more widespread systemic inflammation. These are the diagnostic tests that we'd be looking at. The ESR would be elevated with inflammation. Got your normals here. CRP would be elevated with inflammation as well. And then white blood cell count would be elevated if the inflammation is related to infection. So treatment, we want to ultimately reduce the inflammatory process, reduce edema and mobility of the involved area until really that inflammation starts to improve. In some cases, surgical intervention may be needed depending upon the cause of the inflammatory process. And then pharmacologic therapy, so some of these NSAIDs right here, those specifically reduce inflammation. Corticosteroids also reduce inflammation. We want to prevent further injury and make sure our patient is maintaining an intake of adequate liquids and nutrients. And that is the end of this presentation. Thanks for watching.